All right, so yeah, today is Tuesday, 7:30, 12:30. We just started our class. 7:30 is a morning class. Woo! Burnout. The massage therapist burnout. Trust me, if you guys work as a massage therapist, you do a lot of people every day, you will get burnout. So you need to take care of your body too. You need to go regularly to massage therapy. You need to do those exercise regularly. You need to take care of your arms. And today we talk about that kinetic line, which is the arm line. We're going to talk about this. How many lines is up there? It's actually 4 lines in that area. And this is our tool. This is a massage therapist tool. So you have to take care of it. And if you're not, you will going to burn out. Burn out, not just physically, also mentally, because so many sick people come in. You see this pain, you see this problems every time. So it's kind of, maybe could be depress you. So you need to learn how to protect yourself. And we talk about this many times. Some people do all different kind of stuff, voodoo stuff, but I will probably suggest you to take a break, to take sometimes vacation, probably like every 4 months, go somewhere, just rest, because your arms is going to get tired, and you're not going to be continue do your job. Also, you might do job, but you're going to hate it, and it's going to create that even worse environment for your body. And one day you can just snap off, like I don't know, take a gun and start killing everyone. No, it's a joke. It's a joke. So kinetic line, arm kinetic line. So we have 4 kinetic lines for our arms, and the first one, it's 2 in the front. It's a superficial kinetic line, front kinetic line, arm line, and deep kinetic line. The difference in the front, it's running the superficial. It's running from it's coming from the neck, coming to your pecs muscle, and on your biceps, also your flexors muscles, and stop at the wrist. And the deep line, it starts. Hold on, no. Superficial deep line starts on your pecs, go all the way to your wrist, and a deep front arm kinetic line, front kinetic line starts from your neck, go all the way down, go outside, go to medial portion of your elbow. So that's what the people say, I have that golf elbow. So we always check that line. We're just not like working on this area. I will show you how I do it and how it's helped. And of course, go to all your phalange. So it's go to your fingers. So that's what's important to open this up. And guess what? The main function of this kinetic line, it's pull and push. So we also go energy go away from our body and towards our body. So if we pull, we need to get that strong muscle so we can pull someone, right? Or something, or grab it and hold it. That's why it's important. The posterior kinetic line, it's affect all those mid trapezius, elevator scapula, go on those supraspinatus, infraspinatus, triceps muscle, and extensors of the wrist. So it's right in here, outside. Also, it's spread on your fingers on the top. So it's a front line spreading right in here when we flex our fist. So the posterior line is get extended and contracted in the front. So, but when you extend your wrist, same thing. This muscles, not the line, is get contracted, and this is extended, right? So this is why important to work the whole arm, just like go around. As you know, agonist, antagonist, if your biceps get, like you do biceps curl, the muscle is contracted up here and the triceps is get stretched. And most of the cases, you need to work on the both muscles, because if this is unbalanced, if my triceps is really tight or overstretched, So my biceps could be contracted if my triceps overstretch. So this is what I need. I need to activate my triceps, work on that triceps as a maybe physical therapy or the bands, or you can even do, when you do massage, you can use the bands. So when the clients use the bands during the massage, if you ask him to do like extension or whatever that it's called French push, or yeah, I think it's a French push. So you activate the muscles and you can work on that and you're going to feel it. And your clients is going to feel where's the problem too. So that's why it's important to work on that muscle. Also, the line, it's stabilize your shoulder. So this kinetic line, this could be stabilize your shoulder. If the shoulder is wobbling, it's not like it's too easy to move, like people slouch forward sitting in that computer. That could be the problem too. So we need to make sure the shoulder is stabilized, that scapula is stabilized. A lot of people have those issues. We're going to work on that too. What else? What else I want to say? I think we're going to do 2 classes for that one because my tablet is not working. So I can't remember from my head what's functioning, how to stretch, all those exercises, but we're going to do manual therapy. So who's going to be jump? You? Okay, let's take that necklace off and jump in.
The whole line.
The whole line. So today, this is going to be the posterior kinetic line. And from this position, what is it?
It's right down.
Down or up?
No, down. Bring up.
Bring up. Okay. So this is telling me something. If this is too high, she might have some already issues. See how this leveled? So she don't like to stretch down. She don't like that because it might be pulling more and she feel that discomfort in this upper body. But I'm definitely feel she's kind of a little bit rounded already. That's not part of the treatment today, but I always get that little, like a bowl and bands. It's always like hanging out around my table. If you guys do some house call, it's always good to have them and just, keep it in your back. But I've definitely gotta put it right in here. So she can actually squeeze and do some exercise, work for those glutes right away. What I'm gonna do here, I wanna just relax her because sometimes your clients, it's coming and they so stiff. They not stiff because they're muscles, because they're scared, because they've been in pain, and I want them just to breathe. So what I'm doing, my first kind of move in this position, I just want her to relax. She's just breathing very deep, slow, and all I do apply like 4 or 5 pounds pressure. When she's exhale, I'm apply a little bit more. Let her relax. When she's inhale, I can move. You see release, get a little bit. And ask you, how's it feel? Good. She's like under the pressure right now. It's hard for her to talk because her rib cage is probably jammed and she can't even like talk. It's not extended. But I'm apply only 5 pounds pressure. Trust me. Shake her up a little bit. Like I said, try to relax her. If she's in this kind of protecting mode, she will protect and she will not going to be let it go. Also, if client's in the pain, trust me, the brain, it will protect it. They will not try to relax. But if you're doing that kind of stuff, and look, she's already kind of release. Of course, we measure everything. We measure the shoulders, we measure the arms, see the arms positioning. If she's leaned one side, your arms is going to be not leveled. See how the shoulder is rotated forward. We do shoulder test. So she's standing and can try to place the arm in the back. See if the distance greater than your palm, it's mean that's mobility in the shoulder. Also, the thoracic mobility could be the problem. Also, what you can do, it's all those tests, bottoms up, you push down, if pain is up here, it could be the shoulder impingement, it could be thoracic outlet syndrome. So all this rotation forward, because massage therapists, because we're doing this constantly, the poor mechanic, the shoulders rotate forward, create all this discomfort. Now you're always shrugging because sometimes table too high and you guys doing all the time. Guess what? You jam that brachial plexus nerve. You get that tingling numbness in your hands. So many therapists get that numbness fingers. That medial nerve is being jammed. So that's what we're going to do today. Continue work because it looks like she's still not relaxed. Yeah, all this and pulling test, like grabbing test. I can ask her to squeeze the ball, or she grab my arm, try to pull me. See how strong she is. If it's not happening. If this is weakness, so we definitely have some issue with this kinetic line. This is kinetic line, important for almost everyone. Athletes like golfers, tennis players, hockey players, boxers, all type of MMA stuff. It's really important because every time when you do punch, that line is get extended and pull it back, so it's have to be quicker, right? All those punches. And if this is some weakness or some motor control problem, you get in trouble. That's why sometimes you can see the people get knocked out in first round. Yeah. And relax. So here, like I said, we can work on that. In this position, I'm working on those supraspinatus, infraspinatus. Supra is right here, infraspinatus. I can feel it. So you find that scapula border, scapula, like look at a scapula spine. And as you know, the supraspinatus on the top, infraspinatus in the bottom. So this is very sensitive area. It's like a lot of points, sensitive points. Why? Because if our shoulders is forward, that's one of those muscles who hold the whole scapula. Of course, trapezius, rhomboids. What I'm doing here, usually, she's already rounded, you see? So that's mean all those rhomboids is going to be overstretched. And to work on those rhomboids, we want to bring this in. We show this many, many times. Let me show you on this camera. Yeah, so you always kind of pull this in all different directions. And you can check the fascia. Remember how to check the fascia. So if you place your hands on the top, you start sliding in all different directions and you feel which way is not working. And look, I'm pulling this way down, it's jammed. Pull it to the left, it's probably okay. And you can also ask your clients, what do you feel? You feel that jams this way, down, up? It's kind of go a little bit up, but it's still restricted. Why? Because she's already rounded up there. It's probably be in all different directions. Left and right, it's absolutely fine, but the down is more restricted. And I will probably work on that fascia to move the fascia around, because if fascia is kind of stuck and you're going to give her workouts or exercise, you see the glutes is actually tight too. See, she can't relax. There we go. You see, I touch it, she relaxes. Why? Because like I said, brain don't have any idea what's going on with the body. Her glutes was tight. I touch it, she released them. That's why we touched people before.
Her rhomboids don't need to be stretched.
Rhomboids no need to be stretched. It's already rounded, so we need to strengthening them. And I usually probably give her bands under the table, and she's doing this, stretch under the table, and I put it together. We already been talking about this. I can give her this one. Bring up here. Grab that band. Just like that, and stretch a little bit. And what I'm don't lift up. Just to the side like this. There we go. It's probably too much for her. And all I do, I pull it together. You see? I put it together. She don't want to be undressed today. That's why we just work through this kind of close. But you understand what I'm trying to do here. I'm trying to pull that fascia together. Put this muscle together. Fascia. I'm going to roll this direction because remember when you push down, it's kind of stuck. So I want to roll down this direction because it's kind of not, it's not going to the side and down. So this is my going to be direction. I'm going to grab that fascia, pull, and work on the rhomboids at the same time. No oil at all. So if I put the oil, that's going to be, the fascia work is not going to be that accurate and very beneficial. But muscles, yeah, you keep activating this rhomboids muscle. You can also work a little bit on that upper traps, but I prefer work on the side position. I will show you how I'm going to do that. So that's, and remember, if people round it, it's always the good idea to slide down. That posterior kinetic line, it's always better to go from head down because we always round it. We want to pull that fascia, right? So that kind of stuff. If I want to work on that, like I said, it's all different technique, all different variation of this work. The shoulder is already forward. I'm going to place that ball right on that shoulder. Here we go. It's already there. I'm going to ask her to push that shoulder down. So push against that ball. What's happening here? She's activated all those rhomboids. You see, if I'm holding it right in here, I can feel. You feel that? Yeah. So what I'm doing here, I also place my hand on that scapular. So I feel that scapular. Let me get that a little bit more. If the ball is too, it's a large, all different size of balls. So I'm holding it right in here, and she's squeeze and open up, squeeze and open up, squeeze and open up. And I just kind of move stuff around. I don't want, again, stretch this. People grab that scapula, pull to the side. I don't want that. Squeeze again. And what I like it, work with that, the ball, when the ball under the shoulder, I do all kind of stuff. I can sit down, and she's going to be swimmer, so she's trying to reach forward. Remember, this line is also help you to reach forward, grab stuff, pull. So when I'm up here, I'm just sit down, hook that fascia with my fascia. Like I said, it's just because the close, but usually it's no close. So I hook that fascia, I'm holding it, and she asks her to move. Yes, and she will feel it. How you feel? So I pull it towards the midline. If you don't want to sit, you don't want to use your forearm, use your palms. And you see I can help. I can grab this arm, place it on my arm, so I completely control her movements, and I'm doing this. She's got a little bit out. You see? I can lock it in her elbow with me. You see, I completely control it. Now I can move forward. She can push against me, push down, push towards me like this way. Push. You see, she's push against me. I feel all this muscle activation. I feel all this muscle in that shoulder. Which muscle is working? Which muscle is not? Okay, stuff like that. You don't have a ball, that's fine. No ball, it's fine. How's that feel? Yeah. Feel good, okay. Next one, you can lock that shoulder in, hold it, move up. Remember, if we don't have that external-internal rotation of the shoulder, so this one is external rotation of the shoulder, and it have to be 90 degrees. If she don't reach that, we try to help her. So you see, I'm going to lean, my back is straight, I'm holding it, push it down, push down your arm. 5 seconds, let's say, push to 5. 1, 2, 3, 4, 5, and relax, and I move it. Move that shoulder. Next one, what you can do here, I love to do that one. It's a shoulder mobility. I come up on the front of the table, grab that shoulder. You see, I slide my hands onto that shoulder right in here. I'm not grab her. I'm not using like my claw. So I'm very gently come up here, grab that elbow, or you can extend, and all you do right here, stick that bone in. stick in, and start rotate. I'm not sure if you can see it up here. How's it feel? You feel that? It's like a clicking there. Let me show you what I'm doing here. If this is heavier person, if this is big arm, of course, it's going to be really difficult. Remember to make sure the back is straight. So you kind of half lunge, you see? If you kind of stay up here and round it in people, you're going to hurt yourself. So that's why you do lunge. Come up here. You see, you can even put this arm on your leg. And all you do, do this rotation. You see what I'm doing here? With this arm, I'm rotate that scapula around. Stick again. Rotate. How's it feel? Yeah, of course. It's all this frozen shoulder, yes. If the table is a little bit kind of, I like to use electric table, but if you don't, I do half kneeling. I always can have a pad for my knee. I can work on that. Infraspinatus, supraspinatus. So no rush, you see, no oil at all. Plus, if she have a close, if you get the oil is going to stay on the clothes, and she's coming back to you and give you a bill for cleaning service. You don't want that. I saw this a lot. Same thing. Grab that shoulder, mobilize, pouring around, moving around. More kind of advanced technique. You bring the arm in the back. Stay on the opposite side. We did this many times. Come up with my arm. You see my arm is straight. I come up, grab that shoulder, pull up. Now I can switch my arm, and that's it. I lock it. Now I hold the whole shoulder. What I'm doing, I'm control. But if I'm stay this way, I can injure myself because I'm kind of lean forward and she pull me up. Now this arm is coming on the top of the scapula. And now I'm straight. My arm straight, my back straight. What I can do here, look, I can move it around that shoulder. I can get that at first barrier. You see the arm is coming out, that's okay. First barrier, what's that mean? I pulled it towards me and I feel that restrictions. Now I ask her to push that down, the shoulder, 5 pounds, push down. Your shoulder, push your shoulder down. Are you sleeping? No, she's wake up. Yeah, she probably passed out. 5 pounds, don't push too hard. People start pushing too hard, very light. Push down, very light. Keep pushing. 1, 2, 3, 4, 5, and relax. And I give her a little bit more. You see, I can get a little bit more. Rotate that shoulder. What I'm doing here, try to bring that scapula back. Get that distance between rhomboids shorter, so pull it back. I don't want that scapula slide away because it's going to create a lot of discomfort. Why? Especially for the woman, because the pec minor and major, it's very strong muscle, it's dominant muscle, and it's contracted in front and create a lot of problems. If your scapula constantly slide off, like I said, this muscle become weak, and this is very, very dominant. It's upper crust syndrome. You can guys look at those combination of muscle, which muscle is contracted, which muscle is stretch. Not the stretch, weakness. It's weakness. So from here, I can work on that. I usually like to work on that infraspinatus, supraspinatus. When I'm standing on the same side, I'm not going to show because the camera, it's all about cameras here. I'm probably going to buy the camera on my head, so get those GoPro cameras so you can guys see what I'm doing in here. Here, next one. So like I said, all different variation. You can put this on that supraspinatus, hold it, ask her to lift it up, move it around, and you feel that. How's it feel? Okay, supraspinatus. Supraspinatus, we just work on supraspinatus. So super above that, the scapular spine, and below. You can feel that right here. All I do, use 2 thumbs, whatever how big person is. I grab that, put this on this infraspinatus, and all I ask her to start, moving around, rotate that arm, do some swimming, reach forward, whatever she can do, whatever capable to do. Go ahead. Rotate. Here we go. Yes, here we go. Look at that. You feel that clicking? She start clicking. How's that feel? I always ask my client. Perfect. After I probably do like around 90 seconds, and like I said, very sensitive. Also, what you can do here, you can apply a little bit oil. I'm not apply oil because I'm use this muscle wrap, and this is what I did. That's it. Look. That's it. Right here. Put it up here only for that because the skin is a little bit dry. She's probably been in the ocean and get a little bit tan hair. So I'm stay. Like I said, the idea is not injure yourself. So that's why, you see, I'm playing my one hand kind of in that rib cage up here. And what I'm doing here, I'm slide my fist. What's going on? Someone calling you? Oh my gosh, she just have the phone under her.
Sorry, from the office. Oh, so sorry.
All right.
I know.
We have a multi-millionaire person out here, so she can stop the session. I'm talking about, like, I have one of those clients. If you have a business person who makes some, I don't know, big money, you're probably going to stop the session. But you always cut that time from your session. So if she's on the phone 20 minutes, you cut 20 minutes from her session. And it's happened a lot. So we just get some little bit lesson up here. Respect your time. If people doing this to you, just okay, you cut the session. My session from 1 to 2. And you want to be on the phone, be on the phone. You want to do whatever you want to do. Just my time is my time. And when you tell to these customers and charge them for this time, they will respect your time. They will never do that to you. Only if they, like I said, very busy people, lawyers, Hollywood celebrities and all that stuff, it's why not? If you get paid, you get paid. But she's still on the phone.
Yes.
Okay. See, we're waiting till Marina is going to finish talk.
So sorry.
Yeah, businesswoman. Businesswoman. All right, businesswoman is over talk. Here, I'm not grabbing that scapula and pull. Like I said, I'm just grab that fascia. You see my back, my arm is straight. And what I'm doing here, I'm just pull straight and from medial line to the lateral. And I'm stop right there. If you can see it. So I pull, and this is my speed. My speed is very slow. And I finished right about there. Again, you kind of, the scapular border, it's between your index finger and your mid finger, so you're not pushing it on that scapular border. If you're pushing on the scapular border, it's going to be on that spine, scapular spine is going to be super painful. So this between my 2 fingers and between my fist, and it slide down, and it's never going to be painful. From here, look, I can just switch, transmit, and push down this directions, right? Just whatever you, like I said, whatever you feel good. I'm probably stop right there. I can feel that triceps. You can come over here with 2 hands. I don't know which way I have to show. Yeah. Put this 2 fists together just like that. My fingers is together. And what I'm doing here, I'm leaning on it, as you can see, and sliding down. Couple times. Slide down. Just like that. So medial to lateral and a little bit down. Also, you can grab and use your palms. Same thing. grab that whole arm, put on the triceps, as you can see on this camera, and all you do is sliding down couple times, sliding. So do not push on that bone, do not push on the humeral bone, because it's going to be painful. If you did couple times, you can ask her to contract. So do this, open up, get some muscle action. Same thing, so ask her, grab, lift it up, place, you see, you hold it. If it's a big arm, like I said, this is the best. Use your knuckles. And don't forget, 10, 15 pounds pressure. So you see, extend your arm, extend. Okay. This way. That's okay. Here we go. And this is what you're doing. Slide down. How's it feel? And I feel biceps, and I feel everything. I feel triceps, because she do flexion and extension. So in this case, I feel that. So you see, I'm holding and I'm lean with my body. I'm straight, and she's going up and down. I know. So here we go. Extend it. Here we go. And you just hold it. She's working now. You just hold it and kind of slide a little bit down. Good. How's it feel? Also, which is the flexors muscles, it's easy to work. I usually work when person is facing up. Here it's so easy. You just use your knuckles. You can use your palms. You can use everything you want. I'm staying on the top of the table, holding her. You see, she's already popped. I'm not pushing on that elbow. I don't want. A little bit lower, you see? And what I'm doing here, I'm just slide down. No oil at all. And this is what I'm doing. Slide down towards that arm. I do not want to come right in the middle of the wrist. I don't want that carpal tunnel nerve be more jammed. And people come in, they said that tingling, numbness, definitely. You see, that's what I'm doing slowly. Couple times, 3, 4 times here. How's it feel? Feel good. And that's it. Look, I'm standing here. I'm leaning. I can, my knee against the table. I'm not gonna falling down. I see people sometimes doing this. They stay on the toes, and what's happened to them? They doing this. I don't want to poke someone in the butt with my face. So that's what I'm sliding down. Yeah, can you think about it? If you're doing this and you, yeah, that's not gonna be fun. And now I'm going to ask you to start doing this. Flex your wrist, get your wrist. And when I'm going down, you kind of pop this way. So she's doing action. She's kind of that, do some, what's that called? Yeah, it's some exercise. I remember at the gym when you're sitting down and you start doing this, create that big forearms, especially for those kettlebell people or, there we go, and contract it. You feel that? It's more. I feel that more. Try to relax that muscle. Again, pop and let it go. Yeah. I don't know. Some people I see, they work on the palms, the fingers this way. I don't know. It's too much work. Like I said, here we go. Look at that. That forearm is so relaxed now, especially for massage therapists who's doing that. People who's use their forearms a lot, this is the best treatment. So I'll show you. Yeah, so I don't know. For me, it's like, think about it. I have to sit, lean. No, I don't want that. But what I'm doing here, yes, you open this up. You grab that pinky, big thumb, place that right on that puffy space. Do not push in here. You don't want that medial nerve push more. And sometimes, like I said, that tingling numbness in those fingers, that's a medial nerve. So I want to open this up. Kind of a little bit traction. I pull and open this up. Right here. You want to work more around that palm. Knuckle, the best. Put the knuckle, and you just kind of See, working around. You can slide down. Maybe. If, like I said, dry skin, maybe 1 drop of oil. Here we go. And this is what you're doing. And when you work on that fingers, phalange, you kind of slide them. Let me show you. You slide them between your knuckles. So the arm is coming, the fingers is coming this way. You see, between my knuckles. I'm not put my knuckles on the finger. If you put the knuckles on the finger, it's going to be so painful. So that's why those fingers is slide between your knuckles. Right? Is that good? Now see if I do my fingers to my knuckles to that phalange. Is that more painful? Yeah, so it's painful. Yeah, she don't like it. So between. Oh, you like it?
Yeah, it's good.
Okay. You're right. No, I mean it's fine, but some people say. Yeah. Tell me.
I told you it's good.
Okay.
Actually, it's good feeling.
All right. Some people like pain. Why not? Yeah. There we go. Open this up. And that's, I mean, it's just what's come to my head. That's the most common movements for the arm. Now we're going to flip her on her back. So you flip on this back. This arm is up.
On the side?
On the side, yes. So like I said, you always, that's, now I know what's going on with those face cradle. I fix them every day. You just rip it off and we have a pillow, but she's unbelievable. So here we go. As you remember, we get that part of this arm line. It's our elevator scapula, also trapezius muscles. What I'm doing here, yes, I'm glad that, put this away. And this is the whole space. You can see the whole trapezius is here. What I'm doing here, I'm standing in the top of the table and I just gliding down. You see, I grab that arm, I holding it, I pull this direction down. And what I'm doing here, I'm apply, go not on the front of the portion of your neck, not anterior, go a little bit posterior, and I finish this behind the ear. Go right in here. Some people doing this, they just stay straight, grab that fascia, and pull down. It's also good if you're doing very slowly and look at the face of the client, so expression of the face. See trapezius, breathe. You can ask her to shrug. Shrug. Good, shrug. Shrug. Shrug, it's when you elevate your scap. Very light. You see, she's trying to do more like just light and against that. And I can see, I don't like it because this face cradle is here. I usually put it away. This is the best position, right? Because I'm straight. Yeah, shrug. Here we go. She's doing it. And here we go. Also, the sternocleidomastoid is not part of the chain, but I'm like to work on that sternocleidomastoid here. And I can move the neck, all different directions, tuck the chin, see if any motion in the neck present. And if you guys have any questions, if you want to try some technique, let me know so we go back. Let me finish the side position and we return to the face down if you want to guys try it to do this. Here we go. From here, I can work on the triceps too. I can work on mobility, shoulder mobility. I usually grab that arm, lift it up, you see. Now, if this is left arm, I use my left arm also. So left arm, my left arm. I coming up here, drop that elbow like this, and come elbow to elbow. So you see my elbow and she's on the elbow. So it's kind of like a chain. What I'm doing here, I grab those palm, just like that. And now it's complete control of the shoulder. Guess what? I can work on that pec muscles. I can work on this infraspinatus, supraspinatus, Let me show you what I mean. I'm gonna grab the camera. So you see, coming up here, glide and shoulder down, grab that pecs muscles, minor. I can feel it right in there. And all I do, move, you see? Move towards me, away, towards, away. Now I'm start doing motion. This arm, rotate, boom. You see? There we go. Away, towards. That's the motion. It's like you like open at something. And if you grab that camera, please, for me, and you can put it right in here. So I'll show you. There we go. Right in here, because I want to show this area. So here we go. You see how I hold it? And what's happened here, when I move, I'm moving around. Watch. And look at that shoulder. Also, I show so many times this, you bring it up here, you work on the part of that latissimus muscles. Latissimus also are kind of important to work on. We already showed this moment. It's an eagle. You place that eagle on that serratus muscle and open this up, slide this direction. Now look, the triceps is up here too. You can work on that triceps, right? You can see, depends on, yeah, client, she's holding that, the table, and all you do just sliding down. Like I said, no oil. If she's, it's a, like she got tiny hands, so it's probably going to be the best for me. Just grab it, kind of a little bit traction, and slide this way. And guess what? Look, she can do flexion and extension, and she activate that triceps right in here. Yeah, so side position. See what she's doing here? And I'm sliding. But like I said, if it's a huge person, you can hold it. You can also switch. Probably this is going to be the best for me. And I sliding down. Feel that? I can even help her. See? How's it feel? Straight, slide. Good. Think I need the water. Elbow, why not? I love to work elbow here. Grab that elbow around and just open up. Move up and down. And guess what? My fingers around that area. You can ask her, you can hold, ask her to rotate. There we go. You see? Work around, lock it in. All those movements, all this action. Like I said, it's part of it, but unnecessary to do this here because it's really like a lot of work. Face up, it's way easy to work on that elbow, right? So here we go. This is probably about it, what I want to do here. Also, you can do pull the lats. We already show, grab this, grab the arm, grab the elbow, working on that scapula, try to protect that scapula back. This is one of that technique too. Like I said, you are creator, you are the build. If you don't like something, don't do it because you can injure yourself and you don't want that. Let's go scoop face up. You guys have any questions? You want to try something? Face down, side? Tell me. We can stop the camera and do it. I'll show it to you.
Those grips are really...
No, it's so easy. Watch. If you're standing, if she's on the right side, show right side up, you use your right side up too. It's so easy. So
she's on her left side. Right side.
Right side is up, yeah.
Right side
so
up,
now you come up and you right up. That's it. You see? And you can do, and you can do traction. You see, you can pull her. And now watch, it's just like this.
Oh, I see. You go underneath.
Like this.
Okay, right.
Yeah, and you just start lock it in and Don't hold me so tight. Here we go. Yay. Armpit, armpit, and boom.
So
That's it.
Her hand
That's it, yeah.
shows, so she externally moves.
Yeah.
Right.
Yeah, that's it. You, Yana, you know that one? You know that one. We did so many times. And yeah, and this arm, you can come in up here. You see if you, and do all that kind of stuff. Put your goddamn phone away.
Right.
You're not that like, it's not that important. You see, support, and I do all that stuff. I can mobilize that.
Is it possible? It's not pain, but I feel more.
Yeah, of course.
Intercostals on the ribs.
On the ribs, serratus?
No, scapula, because of the scoliosis, maybe.
Yeah.
It's probably from that. Yeah, I feel more this time.
Yeah, of course. Like each side, especially this is your right arm. This is your dominant arm. You use your right arm, right? So that's why. Go ahead.
Because of the scoliosis, yeah.
It could be, yeah, but that's the right arm is a dominate. Okay, here we go. Perfect. Yeah.
More upper, yeah.
Yeah, more like here. Try to stay a little bit closer and back straight. Here we go. Perfect. You tall girl, so you can. Yeah, feel this in here. Let me show you first, and you're gonna.
I need to move the scapula.
Yeah. So no, watch. No, you did right. So I just want to show you. Relax. She's also not relaxed. So you see, yeah. So you grab it and you start doing this. You see, you move and there we go. She just popped. But you come up here. It's called tuning fork. You put that tuning fork on that top of the shoulder and you start doing this. You see, you rotate. There we go. Now you see it. Here we go. See? This is different. This is like you start moving that scapula. Yeah. Try it. And come up here. Yeah. And this one you hold and move like this. Your elbow open up. Slow. Don't rush yourself. This open up. Sorry, we're gonna put this on this camera so you will see what she's doing up here. Trust me, you will. It's just practice. Yeah. Here we go. More like upper. Move more like an upper body, like this. Yeah. Something like that. Yeah. It's you getting there. You getting there. And the shoulder is moving more faster. More better. Okay. Yeah, here we go. Don't rush. Slowly, yeah. Use your arm against your hip right here. Put this elbow on your hip and now get closer. So here we go. So you move your whole body. You don't move your elbow. If you're gonna move your elbow, you're gonna injure yourself.
Should I move also arm while?
Yeah. Try all different variation. Here we go. Yeah, look at that, and it's pop. Get that motion. That's frozen shoulders and all that stuff. Thoracic outlet syndrome. Perfect. You see, she's moving around. Lucky Marina, get massage all the time. Sleepy, good. Yeah, you can grab that. You can work on triceps. Yeah, you can grab up here. You can use your knuckles. You can use your arm. You can pull this way. You see, it's already work. It's even like this. It's perfect. Double hands like right here. You want more? Grab here. Pull this way. Here we go. Try it. Yeah. Good. That's it. I'll show you. Here we go. Yeah, look at that. Kind of more push on the side, not in the middle. And stop right there. Perfect.
And from this side,
This side, you just grab the elbow and and here we go. Yeah, you can do all that stuff. Exactly. Move around. Perfect. Like I said, create your own move. Like you will feel like what exactly need the clients, because you move that fascia around and you will see what's going on with the arm. If the arm is like floppy and you can move all that stuff, what's going on? Jesus, she's on the phone.
this hand.
On the phone. It's like a busy people up here. Los Angeles people so busy. They're always on the phone. They make some deals, sell some shit. Lawyers. Who else?
What else?
Hollywood. Call me. All right. So,
What
yeah.
else?
That's like I said. Whatever you want. Whatever. That should be it.
You're feeling something here?
You can stretch the pecs. Remember, you can stretch the pecs. You guys always come with a camera. Soreness. Yep, it's kind of part of that. What's a teres minor? Kind of teres minor right now.
Teres minor.
He's might a little bit lats is up there, always lats.
I can feel it, yeah.
Like I said, you see, David, he's create completely his own stuff and he's moving around. He's working slow. Yeah.
I can feel where it can be. So I'm just moving it because this muscle, the teres minor on her isn't moving well at all. Other things are, but so that's why she's feeling something there. And usually it comes from also her rear delt too. So I have to I check the rear delt.
Yeah.
So I'm gonna go in and pull and find out where it's stuck in here.
Yeah. This is more like local,
Yeah, it's more specific.
specific muscle stuff.
She uses this so much when she's massaging. She's doing a lot of.
Correct.
Does it feel tight in here?
Yeah.
So you can just this just needs a little. Sometimes things need a little extra, like here. This
And we can
little
mobilize that.
section. But he warmed it up. I mean, he got a lot of movement to break it to. Now we're narrowing it down. You know, but you had a lot of things in there that were tight.
Yeah.
But all that mobility.
Let's flip her on your back, and here people ask how triceps, biceps. You can also work up here. It's so easy. Triceps. Let's finish with the triceps. You come up here. You grab that arm and you kind of place that arm down. Look at this. This triceps is always open. You can also move this way. You see, open this up. Now, the triceps, I can use both arms. It's a bigger arm, her tiny arm, so I just use my tuning fork. I come up here, 1 drop of oil. I'm holding it right in here, and I slide down. Also, I can hold it and do this way. Probably have to hold, like I said, it just depends on the side. I probably have to stay here because the camera, and I just extend it. You see, I'm extended this arm, and I gliding down. I'm extend and gliding.
You gotta be careful of the nerves on the inside.
Yeah.
Because there's all those nerves.
No, yeah, exactly. So
Yeah.
it's right in here, but I just grabbed that triceps head.
Right.
I separate that triceps. You see, it's right there. I can feel it's a bulky, right in that area, it's bulky. What I can do, I can hold it and ask her to do this. Extend arm, elbow, and I just hold it. Go ahead, extend. Don't hit me in the balls. Yeah, some you will learn, trust me. I get kicked twice or 3 times. I learn to stay away because I'm Okay, now extend it. And she's like, boom, that's it. That's it. You just like, you you probably like out for a couple minutes. Yeah, and you don't want that. Yeah, it's happened a lot. I do bands too. I pull the bands and and she released the band and slapped me in the face. Now I learn. It's all come with the practice. Always stay away from people movements. Once, the person was face down and I was standing up here. Her arm was here and I touched something like sensitive or she'd be like a ticklish and she raised the arm up and boom. Exactly. Boom, boom, boom. So be careful with this boom, boom. You don't want that because you still need it. I mean, if you don't need it, that's fine. So, all right, pecs muscle, remember. So we start, I just show you the variation of triceps work. Like I said, here, we bring this arm, you sit down, the arm, if it's possible to go 120, so this is 90, a little bit up. So this is 20 degrees. And all you do, this is the close. I don't want to use my hands because the close. I don't want to put any oil on it. But I grab that pecs muscle. You see, I move her. I can glide. When I glide it down, the whole body is moving. That's mean I hook that fascia. And I hook that fascia and I just hold it. Now I'm trying to slowly gliding medial to lateral, so away from the body. Apply 4 or 5 pounds down and hook it up. Start gliding down and ask her to do what? Action. Exactly. Feel that pecs. To release that pecs. If this is the person is big, you see she's rotated. I ask her to rotate the whole shoulder. You see we're working on that shoulder rotation here. This is so easy. I'm leaning with my body. You see my force is coming. You okay? No pain?
No.
5 pounds pressure, but if I go a little bit further, it's going to be more painful. And guess what? The guy sometimes super sensitive in the chest. Mm-hmm. You'll see that big guy coming with the chest. You start pointing like 2 fingers, and he's like, oh my God, because he's do too much bench press, too much work on that chest muscle, and muscle is like sore in pain. Pecs always sore. So release those pecs. And that's a problem is people work more on the pecs. They make them stronger and bulky, but you make a weakness in your back. Mm-hmm. So here, or if this is a small person like Marina, I just place my palm right in here and kind of gliding down. So same thing. I can help her out. I'm kind of work out to ask her to bend, reach forward. You see, I'm just show it to her. I can lock it in, ask her to push up towards me this way. I show it to her. So what I'm doing here, I grab that shoulder, rotate. You see, I'm doing all this motion with my whole body. I'm not just doing my arm because I'm going to injure. If I'm going to do this, I'm going to injure my shoulder. But I'm lock it in. And I lean, come back. Lean, come back. You don't need to do this if you don't want. It's just lean, release. Rotate. You see all different directions. I can floss that nerve too. Remember, we're flossing nerves. Come up here. Come towards her head. You see, I'm holding that 4 fingers. And I come up here. Towards her ear. Like that. The military, military salute. You doing the same thing, but at the end, you kind of rotate that palm towards the ear. This is the great. Biceps, same thing. Biceps, you can stay again. Don't do this. Do this. Stay. Gliding down. If this is small arm, grab it. Gliding. 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 Ask her to pump. Why not? Pump. 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 Now, elbow. This is my favorite work on elbow. I bring it to the table. The elbow gets support. And that's the pronation of the shoulder. People always like that. When people come into you and they're standing like this. Yeah, this is already, you see that big thumbs is pointing to each other. This is okay, normal anatomical position. This is This is what they teach you in the school, that the fingers have to point it out. In those in our civilization right now, we're all in the computer, we're all in the phone. This one, if you're pointing in this direction, it's okay. But now the most is like this.
Like gorilla.
Yeah, gorilla. I mean, I'm not that bad, you know. So, yeah, the girls always say, "Oh, I want that nice, like, good-looking guy." You need the guy have to be a little bit prettier than gorilla, so you can say the difference between man and gorilla. If your boyfriend a little bit better than gorilla, that's his perfect boyfriend. So you don't need all those Brad Pitt. So I'm just joking. All right. So pointing elbow down against the floor, against the table, not mean towards the floor. What are you doing here? You grab it and you start doing this. Little bit mobilize that tennis elbow. You see, that's what I'm doing. Rotate. My arms is straight. I'm pushing down. I can bring her to the first level. Resist me. Ask her to bring back. Okay, it's painful. I'm light up a little bit. Don't push too hard, because you push too hard.
Where is she pushing? Oh, she's.
Where do you feel pain? Outside, inside?
Here.
Oh, because I'll grab you.
Yes.
Okay.
Too much.
Too much, yeah. And guess what? Here, same thing. Tuning fork, one arm, knuckles, palm, everything you wanted to use. I don't know, your knee, you can do this. Why not? If you feel okay, if you can balancing good. Or, yeah, I see some people doing this. They just put it up and they doing this. No, that's what Chinese people do, right? Yeah, they Thai massage, you lay down and they start use that knee. So some people like it, some people don't. But guess what? You can do spend a little bit CBD in Marina. I don't want to do this, but here we go. So no oily. Here we go. I can slide down and she can do curl. Just do biceps curl. Yes, and release. Feel that? Yeah. I feel every single muscle and I go all the way down and spread out. Again, down and out. And I work on extensors and the flexor at the same time, because when I'm gliding here, I'm also glide. If this is too much, big arm, like I said, hold, slide your knuckles. You don't want it, put it down, slide this direction. All the way up. We not push right in that wrist area. We don't want to compromise that carpal tunnel. Open up. You see, this is what I like to do. I come up here, grab the fingers, open this up like this, and this is what I'm working on. Open this up, open this up, open this up. Yeah. Also, I can ask her to give her some ball, ask her to squeeze, because also you can see if your clients don't have that squeeze, that strength in the squeeze, something going on, that weakness. So you always give him something to squeeze. And from here, like I said, you can do all this. Open up. You see, come up on keep working on that posterior line now. Open this up. Front, why not? Open up here. And this is great. I always like to work on those phalange. It's always good. We're gonna have the separate topic about the hand, the palms, hands, and the foot, because we kind of be learning a little bit of reflexology too. So this is what I want to say. Elbow too. You can bring this right in here, grab that pronator muscles, and you see, extend. She can do it for you. How's that feel right there? Yeah, it's good. Always, all this muscle, this pronator, supinator, which is rotate your arm in and out, all this motion is always tight. Why? Because it's like right here, right? This is going to be contracted. Grab it, open up. Boom, 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 right there. And I show you the last one is going to be shoulder mobility. And like I said, it's a bunch of stuff. I show you the 1, 2. Remember with the triceps. Now, that shoulder, this is my favorite one. So you come in, you grab that arm. If I'm standing close, my left one, so my left is going to be get that action. This arm, I lock it in under my armpit, you see? So I'm holding it. Now my arm is coming on that triceps, on that arm right here. My other arm is kind of support and slide under that scapula. So I'm not allowed that scapula move a lot. I'm hold it. Now watch, I'm just lean with my body, that humeral bone inside that socket. And if you want to go a little bit lower, you can, like I said, lower yourself. And what are you doing here? You start moving that. Mobilize that shoulder. She's like. Or you can just pull in and out, pull in and out. Very slightly. It's too hot and it's hard to talk now. And this is great stuff. Look at that shoulder. Look at that arm. So, that was kinetic line. Of course, exercise, 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 and one more time exercise. Get that forearm strong. Get that shoulder mobilized. If it's not, we're going to get problems in the future. You guys want to try it? Yeah, like I said, we can do a lot of stuff for this. You can yeah, come up here, slide it under. I ask her to push this down. You see what she's doing? Yeah, she's kind of like push this arm up and kind of like push, no, like up and push down. There we go. So she's reactivate. Yeah, you see?
Exercise.
Yeah, it's exercise. You can do bands too. You can come up here, give her a band, and working on her pecs when she's doing that. Remember, you know where the muscle is. You know how to activate that muscles, and you do it. So you just ask her to grab that band and come up here. You see, I'm control it, and I don't want to do this. Yeah. I don't want to look at this and doing that. So I'm away, exactly. So she's right here, push up. No, push up. Yes, like right in here.
Okay.
She's also stabilized her shoulder. Hold and try to, and hold. No, try to push and hold. What she's doing here, she's stabilized that shoulder, right?
And you can go up.
You can do whatever you want. I can work on that, not towards me. No, up and down, up and down. So you see she working on that pecs. I grab that pecs and I'm working on her right now. I feel that pecs. I'm holding that muscle and she's worked through the create action. Make sure she's not pointing to her face and to your face because you don't want that. If she slap you in the face, so I'm away. If the band is slide off, it's going to be like that. It's not going to be hurt anyone. Okay? Same thing. You can, I show so many. You can step this way. Grab. Here we go. Hold it. That's it. Pull up and down. Look at that. So much stuff. Look at that. And I can see all this muscle is active. Let it go. Okay. What do you want to show, David? The shoulder? Go ahead.
The elbow thing.
Yeah. Show me the elbow thing.
You like this.
Yeah, stick, push down, and start rotating. Don't lift it up. More open that way. You want to do rotate out because remember that's pronation. There we go. Yeah.
So you grab.
Yeah.
Like over here.
Lean with your body. Doing good. I really like it. And like I said, it's so many. I can show many arms variation.
It's great. It's really cool.
Yeah, right there. Show you again. Right here. You see, I pull it on the side already. So, and now I lean. I'm not put in rotation and lean because I want that how as much as possible open it up because her arms go so easy right here. This is for restriction barrier, and I start lean. Try to relax. And I sliding down, of course. Or you can do this way. Why not? Chicken dance, not a chicken dance. Yeah. And relax. Chicken dance. And relax. Okay. All kind of stuff. Oh, what I forgot. I want to, we show this many times. That clavicle, I think it's a acromial clavicular, AC joint. You wants to make sure it's moving. So what you're doing here, you grab that clavicle and you move. And if it's painful, sometimes you need to pay attention. You see, this is shoulders rotate forward. So I'm just moving around and work also on that clavicular muscle right in there. Very gently, just point this out and work on those muscles, okay? And make sure it's movable. All right, you guys have a good day. We'll talk about that spiral line as a function, exercise, stretching, and we go from there. Otherwise, we good. Oh, flip face down one more time. I want to show you another test. I will learning this test. It's a really cool test. It's great for the athletes. If athletes come to your office, you want to check those kinetic line. I'll do it. So the idea is to check how the upper body communicate with the lower body. And this is very cool test. We do this exercise every morning and it's really been strong for me, but for some people it's not. So this is called cross pattern. And we also learn how people can, how strong they are. So extend your arms right here, hold it. And what I want you to do, usually it's you take a shirt off and you see which muscle is contracted right away. You can see it, yes. So you're gonna extend this arm. You can hold this one too. No, like this. So I want you to raise your arm and leg, this one up at the same time. Try to raise up. No, just this one, cross. Right arm and left arm. Here we go, and relax. One more time, yes. And let it go. So you see, I'm holding this kind of on the hamstring and around that shoulder, very light. I just touch it. I'm not apply pressure. And ask you to raise up and relax. Let it go. One more time. This she's okay. She's fine. Yeah, no, it's firing up altogether. Sometimes you feel the arm is coming first, and after this leg. That's mean people. They have some difficulties, and they probably have that rolling exercise difficulties. It's hard for them to get up. Remember, we do this rolling test. Go ahead, roll face up. So you got the idea, right? You hold that kind of around the scapula, hamstring, a little bit glutes, and raise up again. And relax. One more time. And you switch side. There we go. One more time. Yeah, here, the arm is coming first. I feel this contraction in the arm, but the leg is kind of a little bit delayed. One more time. Yeah. Now she's, go ahead, scoop down. Maybe that's because that face cradle. Scoop down and try to do this. Yeah, maybe that's going to be the best. Extend your arms forward. Try to keep your head down. Now it's probably going to be better. Raise up. Boom, let it go. One more time. Yes, now she's better. Again, come back up here. Yes, good. So a lot of people don't have that. That's mean it's this line, the cross-functional line is not working. Remember, we got this axis. We need to make sure it's working. And this is also treatment. If you put it up here and she start raising this for like 10, 15 times, it's going to be spark up and it's going to start get active. Okay. I'm done. You guys, you want to talk? You want to do something? No? Okay, perfect. It's 2:00. I think we did a lot of work. You guys, like I said, practice. After the class, you can just practice on each other, and I will help you out.